So, hi all, I am Vrinda Bhatia, Assistant Manager, Event Execution Observe Now. I would like to thank all of you for joining the Ekincare Presents HR Leader Virtual Session powered by Observe Now Media. Topic for today's session will be flexible healthcare at home, evolving from manual care to mobile health. Just to give a context on what Observe Now is, so Observe Now is a young niche B2B digital media startup that curates exclusive knowledge sessions with thought leaders in education, human resources, startups, BFSI segments, etc. You can check us out via social media and our website. So now I would like to introduce our esteemed speakers, Ms. Rishu Garg. She is the Chief People Officer, Zivame. So, hi, Ms. Rishu.
Hello, Vrinda. Thank you for having me.
Yeah. Then, Mr. Amar Salvi. He's the Senior Vice President, HR and Training, Anunta Tech. Hi, Mr. Amar.
Thanks, Brenda. Thanks for having me over here.
Yeah. And now I would like to introduce our esteemed moderator, Mr. Sandeep Shivram. He's the Director of SDR and Inside Sales, Ekincare. Hi, Mr. Sandeep.
Hi, Vinda. Thank you for having me as well.
Yeah. So now Mr. Sandeep will take forward the session. Over to you, Mr. Sandeep.
Lovely. Thank you again, Vinda, for the introduction. I thank you, Rishu and Amar, for joining us today on a Thursday in the evening. It's been a long day, but let's power through this together. I want this to be a very casual chat between us while I set the expectation and the context as well for our audience and viewers. It just so happens that this is our third webinar series we're doing with Observe Now. And we've always had other HR leaders talk to us about various different issues regarding health and healthcare. And I'm very eager, I'm sure I speak for the audience here as well, eager to hear your insights, your thoughts, your learnings, and what your plans are based on that for the future as well. So without further ado, I think it's the perfect time to start this session, especially in December, because this is one professionally, from an employer standpoint, it is the end of the year. We look back and see what we have done, how much has changed over 2022. And it was a very crucial year for us, considering a lot of offices has opened and people had to come back. But personally as well, I think it's a great time for us to also spend time with our families, considering the holidays are near. And I'd like this, again, like I said, a very casual conversation going forward. And we do have some questions that we'd like to ask you. Share your insights. If you think the question could be tweaked a little bit, that's even more insight for us and for the rest of the viewers as well. So again, when they introduced me, I'm Sandeep from Ekincare. I head the inside sales function. Just to give you some background as to what we're going to be discussing, one of the things that is really pressing right now is how workforces or people have been ever evolving over the last 3 years, especially what we're calling as the pandemic and then during the pandemic and post. We've realized within Ekincare, and we've realized talking to HR leaders like yourselves, that one size or one healthcare package or a plan does not fit all, right? The diverse workforce involves diverse needs based on people's lifestyle, people's medical history, and a multitude of other factors. And these factors could be their support systems, their parents, their friends, near and dear to them. So one of the things that we'd like to be discussing today is how we shift from a pre-pandemic, which is a very traditional way of engaging with employees through health and benefits, to how we move into a digital first sort of approach, which also gives greater ease for people based on wherever they are, depending on whether they're in a city far away from a metro or within the metro itself. And I'm assuming here, and I'm speaking for a lot of HR leaders that we've spoken to in the past, that we understand the importance of flexible employee benefits plans. One, to obviously provide better revenue for the organization, but also to keep a check and improve and hold on to the company's most valuable asset, which is people. So with that, I think the tagline for me for today's conversation would be the future of health, or the future of health benefits for your employees, needs to be a little more flexible, considering of the world that we live, right? All right, so let me jump straight into it. We have some questions, we have some time. I'm going to let this open, I think, to the last 10 minutes for anybody on the chat who'd like to answer, ask questions for you to answer. But we'll have that in the last 10 minutes. But first, I'd like to bring this up in terms of what we've been through as individuals. We've, over the last 3 years, we're coming up to 3 years now since the first lockdown, how life was prior to the pandemic, how our health benefits plans were structured, your health benefits plans were structured, how are they structured now, and what have become permanent fixtures in the process of 2022 and 2023. It will be great if, Amar, if you could answer this for us, how it's changed from what it was to what it is and what it could be in the future.
Yeah, sure. Thanks. You know, for me, the journey has been quite personal. I went through COVID myself, and I've seen it firsthand. Uh, I'm sure everyone over here can relate to this. Back about 2 years back, when COVID really hit us, there was panic all over. People were falling sick left, right. And what initially started off by people thinking that, hey, I know it's out there, but it won't happen to me. It's going to happen to my neighbors, but not to me. I think everything went just out of the window, where people started falling sick, and it started coming nearer and nearer. Uh, we we were quite fast to react as a company, and our workforce spread all over. Many people went to their tier 2, tier 3 locations. Some even went to remote villages and started working remotely from there. But COVID was catching up very fast, and people were falling sick. Relatives were falling sick. There were some deaths amongst relatives. And I still remember, I stay very close to a hospital, and the sound of the wailing ambulances as they kept on increasing. I mean, it was a nightmare that we all went through. And during this time, the need was to assure our colleagues, our employees, that we are there for them and do everything that is possible within the constraints that were there. You must remember there were no vaccines available at that time. We were not sure what we were dealing with. Doctors were not sure how to treat with this. And so the most important thing was to speak to people and just be there for them. And that's how we started off. We had a medical response team of volunteers who were reaching out to people, checking with them, guiding them to the nearest hospital, checking for available beds. All of that was going on. And that is the time that we also engaged with Ekin Care, and Ekin Care helped us, with the 24/7 helpline. And that went a long way in making this care reachable to all our employees, even in the remotest of places. And that particular period, having this facility available to them helped us get through this. So just the very fact that the employee says at the end of it, I'm glad that there was somebody I could reach out to, and just being there for them was the most important thing. When you look back at the journey that we have covered in the last 1-2 years now, what was once considered to be a luxury, doing annual health checkups and all, I think is now moved mainstream. We're talking health and wellness much more than what we were ever used to. We ourselves went through the whole lot. We went through vaccinations. We made sure that all our employees, their families are vaccinated. We started working hybrid. We came back to office. We announced beginning last year, that this would be Ananta's health and wellness year. And we started off with the Get Fit Challenge, just to get people moving on again. We started with the health awareness series. The annual health checkup just happened. That gave goals for the next Get Fit Challenge. So all of this is now becoming more as part of what you would want from your employer. And the employers also want this, because what in turn it gives us a more resilient workforce, a more happy workforce, which is appreciative of what the employer is doing for them. And, I think that is a journey that we have, passed. And some of these things are now here to stay. It's not a passing fad as such. This is here to stay. And I think that's been the journey for us at Ananda. I think I reflected when I look outside and speak to my colleagues in other industries, other corporates, that's similar to what they are going through also. And this language of health and wellness is becoming more and more part of our daily conversations itself. That's what I would say, has been my personal experience as well.
I agree. I think to some extent it's safe to say that we took for granted post 2020 what health really could mean for employees. And during that entire process of learning and talking to people, I think we've made changes. I've made changes to my healthy lifestyle, and I'm sure employees and workforces have done the same to ensure that it is not a 2-year affair. It is the constant battle. It is I'm sorry, my internet's a little slow.
Yeah, I was checking mine.
I think it is mine. Sorry. What I was saying was it's not a yearly thing. It's a multi-year. It's over a decade. It's constant learning, constant change. But thank you for that. I completely agree with you. We've moved from learning to stages to now implementing into better work culture, better, healthier work environments. I think what I'd like to also ask Rishu is just a simple perspective. I know that we've all been through similar situations where we've lost relatives and all of that, but have there been changes in the organization from your perspective of things that we've learned from in 2021, 2020 that are stagnant and constant now?
Oh, absolutely. Completely agree with what Amar just mentioned, that health has taken a seat that is front and center. It is a strategic priority, and that's how all organizations are treating it now. And a lot has changed. Number one, of course, that you have a really distributed hybrid workforce. Everyone wants flexibility. People now expect organizations to meet them where they are. And that is not only the location, but the time and life cycle, as Amar said, that they're going through. There would be young people in your team. There could be people who are in their middle ages, who have caregiving responsibilities. There are people who are on their way to retirements. And, the health needs and the health expectations for them is all very different. So I think organizations are now thinking about and working a lot on making the entire healthcare really flexible and personalized. So there is a basic plan that applies to everyone, and there is this package that you can choose based on your needs. Another thing is, I think every organization, whether small or big, they're setting, like every strategic priority, they're setting goals for themselves. It's not like, because everyone has a health insurance policy, I also have one. But, what is my long-term goal? As Amar said, I may not be able to afford a gym at every office right now, but I can encourage every employee to walk.
Yeah.
Right.
Correct.
So can the leadership team, can the entire system come together? Can we have communication and focus in this area so that employee health is prioritized? So I feel in that sense, a lot of flexible options, a lot of new options. I remember about in 2019-20, every time our health partners would kind of say that tele health checkup and all of this you should take. And I was like in a metro having 5 hospitals, thought I'll never use it, and around me. And but yes, and the pandemic comes, and I was in an essential service then. I remember working like 20 hours a day on a laptop, and my eyes gave up and had no option to go to a doctor for an eye checkup. So that telehealth consultation came in really, really handy. And from then I feel not only going to that piece, small piece for small ailments, but to go to it for second opinions, for clarifying, health issues for which you may not have gone to a hospital. So small services like these have made life much easier. So I feel yes, a lot has changed over the last 2 3 years, and all the organizations are now treating health and investment in healthcare as a long term goal. It is not something that you do it once and forget about it. It is something that you achieve small milestones every year.
Correct. It is forever changing. It's always trying to figure out if there is something new out there that we aren't giving to our employees, or with existing employees, how do we ensure that they have access to more things, which is, I think, very important. So, Rishu, just a quick question to this, or insight as well from my side. You said something about just making people walk. I think that's goes a long way, even if it's just basic. It's still adding steps for your health needs. And in fact, at Econ Care, we recorded a total of 1 billion steps from all our employees across. And we found a way to say, hey, the more steps you do, the more we incentivize you for you to become healthy, right? And I think that's the perfect way to engage with somebody and say, you are staying fit and healthy, and I'm incentivizing you to continue staying fit and healthy in the future also, right? I think it's a long-term goal, but if you don't mind me asking, how do you plan for these things? Is it a yearly plan? Do you look at it in terms of 5 years, based on what kind of benefits you have to give, based on your diverse workforce, of course?
I think the long-term plan stems from the long-term goal that I need a very healthy workforce. Any investment that I do today, the ROI will not show like next month or next quarter. It is something that I will see in 2 years and 3 years in terms of lower healthcare costs, in terms of lower absenteeism. And I think in general, a healthier workforce gives you a huge competitive advantage. People are just focused more. So if I was to talk about goals, I think uh, it is a mix. So there is a long-term goal. There's a 5-year plan, and this is how I want health to look like in my overall people strategy. And then backtrack it to, okay, so what will I do this year? And to do that this year, what will I do this quarter? Right. As I said, because things have changed so quickly, while of course COVID was, one ailment that all of the entire world went through. But sharing from my personal experience, there were a couple of medical emergencies we had in the family, and in a family that we didn't expect it to happen, and they kind of came out of the blue. And I don't know if it is related to COVID or the environment that we are in. In general, I feel there were a lot of medical issues people faced over the last 2 years, COVID or as a follow-up to COVID. So, and organizations and people were caught really unaware, right? You can't really double your healthcare costs immediately, or you cannot really, think through or envisage something changing so quickly. So I think for the first year and the second year, it also, you set small milestones for yourself. You think about how will my healthcare, okay, this is an investment I want to make, and this is the amount that I can keep aside for it, and therefore how do I bring most value to my employees within this kitty that I have. So those goals are kind of co-created with the employee and the employer on what is it that you value the most, and therefore let's prioritize it this year. And in the coming years, I think slowly as businesses come back to normal, as they have more confidence in spending more in this area, the long-term 5-year goal, most organizations are focusing on more investment in this area. So yes, what is it that employees value, and where do I want to see myself as an organization in the next few years is how we decide our healthcare goals.
Got it. Got it. I think that makes. Sorry, Aman, you wanted to say?
Yeah, just to add to what Rishi was also saying, because it's she was also talking about how she went through it, family members went through it, and all. And likewise, almost every employee had some experience or the other, whether it was with their immediate family or with the near ones. And what we realized was that apart from the toll that it took physically, there was a bigger toll mentally also that employees were going through, all of us were going through. And it was important that we have somebody to talk to. And we started with that. I mean, that just this grouping of coming together online and just sharing of experiences to help each other out, just having somebody to hear you out also helped a lot. And we also focused on a lot of these sessions that will improvise on your mental wellness. One of the things that we also launched over here, I would like to share that has helped us and is helping us is the Ananta clubs. This is an initiative where like-minded people come together. You have a certain hobby, you come together. I lead the aquarium club. There's somebody who leads the carom club, somebody who leads the chess club. And what that has helped is, getting people who are working remotely and separately now coming together now that they're back in office and again, interacting with each other. I think that is helping us in our journey across. I just mentioned the Get Fit challenge, right? This is exactly what Rishu was talking about, the stepathlon, and we just launched the Ananta Get Fit challenge season 2, which is climb Mount Everest virtually. Okay, where cross-functional teams are coming together. Work. So this is feeding in from the health checkup. So they have their goals already set based on what they have got. I think that is going to help us a lot. I'll be honest, we have not planned ahead in terms of 3 years, 5 years now, but we are looking at it 1 year at a time. And I think that has helped us also. I'm sorry, excuse me, Sandeep, my son is there. This is work from home, so you'll have to excuse me a minute. I'll give
Not a problem at all. Not a problem.
No, absolutely. No, adding to what Amar just mentioned, you don't need to. One thing that we realized and is that you need to have a community around you to support your health goals. It's not about having, always investing a lot of money, but if you have your priorities and goals defined, that I want a healthy workforce and I want employees to spend quality time in their body and soul and, mental well-being. And, then you have ways to kind of achieve it. So I think that's something that has been a huge focus area for us too.
Yeah, I think one of the things that we always talk about is engagement. Engagement doesn't have to be employer to employee. It could be peer to peer also, because that's when they talk and say, "Hey, why don't we get together?" Right? Amar rightfully mentioned that people who used to work now together in the same offices, which actually brings me to another question which I'd like to touch on. Is considering that during the COVID world, we moved back to our hometowns and cities or far off places. Do you have the same sort of engagement activities with people in farther, remoter cities? What we call as tier 2, tier 3? How does that work?
Yeah, we just wanted to check, Sandeep. Is there a break in the sound?
Yeah, I think it's my internet. Just give me 1 minute.
Okay.
Sorry, 10 seconds.
Okay.
Can you hear me now?
Yeah, much better. Much better.
Yeah. I closed the door so the Wi-Fi didn't come through.
So the last 2 years have always, also made us conscious of this statement. Can you hear me? Can you hear me now? And also, that's become more mainstream now. Yeah. So on your point, on are we looking at things differently for those people who are working remotely and those people who are in office? Yes and no. I mean, the focus is obviously whatever services we give uh, in office, we should be able to replicate that, as much as possible for those working remotely. So in terms of the engagement activities, if you're doing something in office that is streamed live so that others can also participate and they can join that link. So the there's a conscious effort from the team to make sure that everybody is involved and we are not discriminating against those who are working remotely vis-a-vis focusing only those who are coming to office. So that's not the point. In terms of healthcare, what we have also, since I also mentioned about the annual health checkup, and we have a considerable number working from home. Almost 35% of our workforce is today still working remotely and are still based out of their tier 2, tier 3 locations. So we have tied up with partners who are going to their homes and getting the test done. Okay, unless it's a test that requires them to come to the nearest center. So all of this
Yeah.
is facilitated. Okay, whereas on the other hand, in cities like Mumbai, Bangalore, and Chennai, where we have our offices, our partners have gone to the offices and have conducted these tests. So it's always a balance, and the focus from the HR team is that we should not be seen as being discriminating between these two groups. One is working in office, while the other one is working remotely. That's the whole focus.
Got it. Rishu, I'd love to hear your perspective on this. Do you have employees sitting very
Absolutely.
far away? Yeah.
Yeah, no, completely agree with Amar. So, if I were to divide my, the entire healthcare plan into two, preventive. So these would be, as he said, groups, clubs, outbound sessions, nudging each other, webinars, checkups, just, being like one step ahead in managing your health. I think this is something that we also try to ensure that we reach out to everyone, irrespective of where they are located. And we give an opportunity to everyone. So even in smaller locations, if we have groups of 3 or 4 people, we ensure that we do some sort of games, or we call them, for some sort of a session, so that there is both physical and virtual engagements that they go through. In On the other side, which is like the mandatory piece for us, like helping employees when things absolutely go wrong. That is something that we are very now we select our partners very carefully. So we need to have partners who have a huge network, who have where the employee can access healthcare wherever they are, right? So
Yes.
that is a huge point of consideration. The second is experience. That in because of the after effects of COVID, or because of this entire situation, there is a lot of unplanned hospitalization that is happening. So at that point of time, when you're going into an ER or you're going to a hospital, you don't want your employee to be worried about anything except giving care and comfort to their loved ones. So in that sense, the experience and access, and that partner who can provide that experience and access has become like really important, right? Otherwise,
Yeah.
maybe earlier you would kind of think of, these are the 2, 3 places where my majority of the workforce is, and these are the top players in that area. But now it really matters that who is it that who's available anywhere I need them. I
Yeah,
think
I
that
agree.
consideration of those points has come into the consideration. So,
Got it. I think one of the biggest challenges that we always I ask my team, we at Econ Care ask ourselves is, while we have the access for doctors, like you said, to go home and do tests at home, are we driving the same sort of experience that they would get if they go to a diagnostic center or a lab, especially in tier 2 and tier 3 cities where they're quite spread out, right? And like you rightly said, network partners is very important to any organization. The larger the extent you are, the 100% of your employees would have the access to not just health checkups, but also general health queries to be asked and so on. But partner network is something that we have been building for the last 8 years. And it's very important for our customers to know that we are present in almost 8,000, 9,000 different locations across India. And that's one of the ways in which we sort of give the employee the experience the same way they would go to a diagnostic center and get that same experience. And have, of course, one of the topics of conversation that we wanted to also discuss is after you get the home collection or the you go to home and get the check done, your reports are generally stuck away somewhere far away. How do you get access to that report? So digitization, coming into a new world of sitting at home and getting all of this information is also very important. Yeah, I agree. Just slightly digressing from our general continuous flow of conversation. One of the things that I wanted to also discuss with you is uh, during the pandemic world that we lived in a year and a half ago, um, HR leaders who I've spoken to were always very proactive, right? Always talking to employees. Like you said, Amar, we always wanted to be there for them, constantly talking to them. We had a call center team that would constantly engage with these employees to see if their family is safe, if they're safe. Do you think in this 2022 and 2023, now that people are falling less sick, there are lesser number of COVID cases or lesser number of general post-COVID symptoms as well. Do you think that we've taken a sort of a step back in terms of providing a plan, or are we still at that proactive level that we were?
I don't think so. I think it's become part of our daily routine now, or way we work now,
Mhm.
because the groups that were formed then, the WhatsApp groups, we had medical response teams, like I said, for each of these locations. They are now a permanent fixture. Now, how does our HR team get to know there is somebody sick? It is posted over
Mhm.
there. So earlier, pre-pandemic, you used to get a call, somebody's fallen sick and needs help and all. Now it is posted real time on the group itself, and all the leaders are also marked on that group. So there is that added focus saying that, hey, somebody needs. So everybody jumps in to kind of give their two bits on that. Okay, and I think now this is across. It's not about Ananta that I'm sharing this. I see this is now become part of your regular routine, and employees also not only appreciate that, they get to expect this kind of support
Mm.
coming from their employers. It's not about being a best place to work. I think now everybody's striving to be a best place to work, and these are, I would say, these are things that every employer should do by virtue of having people work with them and taking care of their colleagues. I think they should be, taking this as a given. It's now part and parcel of whatever offering you are giving to the employee. It's not just about CTC. This is
Yep,
going beyond that now.
I agree. It is a longer game that we're playing. I mean, it's constant motivation, it's constant being there for
Yeah.
them, constant taking out responsibility for them, not just for them, but their dependents as well. Yeah. All right. Just moving on to Rishu, just a different question that we also had. We wanted to hear your insights on is one of the things that you told at the start of the conversation is we need customizability of different ways in which you provide packages to whether they're young people in the organization, old people in the organization. Um, how important is that customizability today, given the scenario that we're in? And have we, based on the customization, seen better health outcomes from your employees, just from your perspective alone?
I think it is very, very important. As I said, employees today realize that, this is one piece that they need absolute peace and comfort on, right? If
Mm.
something goes wrong, do I have the right plan? I remember my husband and I kind of bumping up our personal insurances, etc. At the start of the pandemic, and we just kind of did it. We thought we are caregivers to our parents, and we thought it will come in handy. And we had like two non-COVID related incidents, as I told you. We had an
Yeah.
accident in the family, and we had a cardiac arrest. And at that point in time, when, as I said, we were, taking our loved ones to the ER, we were like absolutely not worried about the financial aspect of it. So, and as an HR leader, just saying it from my personal experience, that is something that I want employees also to not worry about.
Mm.
Especially a lot of us, when I was really young, I would feel that, okay, that there is a health insurance plan, but I'm never going to use it. Right.
Yeah.
I'm like fit. I don't think I have any ailments, etc. My parents are younger and I don't think I'm going to use it. But once you become a parent, things change, and you have this whole human being's responsibility on you. And once your parents get old and you are caregivers to them, of course, things change. So I feel employees want organizations to meet them at these life cycles. Right. So give me a basic plan, definitely, but give me an opportunity if I want to add my parent anytime. Give me an opportunity if I want to increase my healthcare, after I've gotten married or after I've had a family. So I think a flexible plan really helps. So you may decide that, let's say that everyone in the organization should have a minimum cover of, let's say, 4 lakhs. But if they
Yeah.
really wants to stretch it to 10 lakhs, giving an additional amount, that should be doable. Flexibility in terms of that, flexibility in terms of location. So can you help me with health checkups or delivery of medicines, or preventive care at my location. My
Yeah.
location could be different, my parents location could be different, but do you have a partner who can service these locations? And again, can you do it at the time that I want? you know
Yeah.
so I think the flexible options gives you this peace and comfort that irrespective of where you are or where your loved ones are, you can kind of give comfort and care where needed. So I think flexibility is something that is a huge consideration for most organizations today.
Yep, flexibility. That's to summarize everything that you said. Thank you for sharing your personal your incident as well. Outside of COVID, we're talking about something that's greater, bigger. Flexibility is what healthcare should be. Is what healthcare is right now. It is the future. We are constantly trying to change, constantly trying to adapt to different given circumstances, not just falling sick, right? And it could be as rudimentary as just insurance plans also. Just apart from insurance, what else, right? You hit the nail on the head. Thank you so much, Vishu. Yeah. Um, just a couple of other questions before we move. One is to Amar. How do we give now within Econ Care? We call it as OPD experiences, right? Outpatient departments. We're not going into the hospital and admitting ourselves.
Yeah.
Do employees engage with you saying, "Hey, I'd like to have these OPD services in as sort of engagement activities within the office, within the factory, or within a particular environment where you have dental checkups done for them regularly, whatever it
Yeah.
is, vision checkups
Yeah.
done regularly? How do you provide that?"
Yeah, like I mentioned, it's about the services that we are providing on site, as well as making sure through our partners they are available in remote locations also. And we did start the sessions talking about the Ananta health check. Okay,
Mhm.
where all these checks are being done on site, and the same checks are being done off remotely as well. So yes, it's something more proactively. It's not that the employees are asking for it. It's something that we are doing it more proactively. We also organize ergonomic sessions now that people are coming back to office. And these ergonomic sessions also focus on those working from home. See, when you're working from home, people don't realize you're most probably sitting on the same chair, and then hours pass before you even taken a 5-minute break. There are
Yeah.
days like that also, and then you wonder, was it better off working from office or was it better off working from home? But yeah, those are experiences, and I think we've had ergonomic sessions, we've had sessions through with dietitians where people participated, and some of them were organized with the Eking Care also, I remember. So yeah, so it's been it's been a part of services that we've started offering, and we continue to do that now. I can share one thing that has changed. Definitely, you
Please
asked,
do.
the
Yeah.
first question was, what has changed? You know, the one thing that I see changed, that has changed, is when people now, when we are hiring them and we are having offer discussions, okay, they are also inquiring about the insurance plans. They are also inquiring about the medical insurance. And like Rishu also mentioned, do we have the facility if I want to add my in-laws to it? Uh, and I'm willing to pay extra if that may be the case. But is there the flexibility of doing that? I think post-pandemic, this has set in now. People are more aware of term insurances. They often, apart from what the company provides, they are opting more and more for those insurances themselves. Okay,
Yeah.
I think it's all good in that sense, because people have become more aware of being healthy. I am 50, okay, though I don't look like it at all. I'm 50 now. Okay, but I must tell you this: a lot of my peer group, my friends and all, are running marathons. And they've become fitter. I mean, I'm still yet to join them, but you know, they
Yeah.
everybody's adapted that lifestyle. That earlier, you know, these are lifestyle changes and all. That whole thing has undergone a paradigm shift. Today, when you talk about a lifestyle change, you're talking about being healthier. You're talking about being healthier as a person, for yourself, for your family. I think that is the big change that I have personally seen as an HR professional.
That's yeah, I think it's a paradigm shift from what we were 3 years ago to what we are now. And healthy could be mentally healthy as well. Could be
Yes.
physical well-being. It could be your support system well-being. It's so much more
Yeah.
than what it was. Yeah, you answered it perfectly. Thank you. I just have one. Unfortunately, I just have one last question. I just want to keep this very casual. I think for our viewers and our audience as well, we'll probably move into some questions if they've asked. One final thought in terms of what would be your advice to whether it's a small company or a large company, whether it's a company just spread out across India. What would be three things that you would tell them to cover all dimensions of health needs? How would you give them advice on what they should be doing as opposed to what already has happened? Rishu, we can start with you. Okay, please.
I think, yeah, thank you for that question. I would just summarize what I've said. I think if you were to ask me three things, the first thing would be treat this as a strategic priority. Do not look at it, as Amar said, do not look at it as a sprint. Health
Mm,
investment in healthcare is a long-term investment. See it as a marathon. The second thing would be, now that you know that it is a strategic priority and the overarching objective is to have a healthier workforce, a more productive workforce. Think about what goals do you want to achieve this year. Definitely, as you said, as we are completing an year, reflect on employee experiences. What is it that could add value to them, and think about what goals would you want to achieve in 2023 and define those goals for yourself. And I think the third one would be include a lot of employees in the decision making and in designing your health plan. I think one thing that has changed for all organizations is employees are taking this very seriously. If we would have done an ergonomic session or a yoga session or a nutrition session maybe in 2019, I would have a handful of participants. Now
yeah,
I have the full office joining me, and people are requesting for these organizations to do these sessions for their family members as well. So there's a larger community they want us to impact. So I think
correct.
involve employees, in making the health plan and give them flexibility to, design their own plans where possible. And, the more you include everyone, the more you kind of make a community that nudges each other to achieve the goals that you've set for yourselves. So those
Correct.
would be the top three for me.
Lovely. I think the last point I gravitate towards, because even with Eking Care, we don't call anybody who's on a platform employees. We call them lives. because you're impacting not just their lives, you're impacting their family and friends as well. And I think that's a very nice thing to address when you are helping other people around the workforce that you're currently working with. Also, it's very, very important. Thank you. Yeah, Amar.
I think she said it all. I mean, I don't think I would have been able to put it any more better. One thing is I would say is, and what has helped us as a learning is going overboard on communication. And I think that is a big learning for us, because we started off by over communicating. It didn't matter whether it was the health awareness series, making sure that employees are aware what is the latest thing that is happening. And we continued with the health awareness series on other things apart from COVID and all. And that has really helped. The people connect sessions with the CEO, with the HR, those are things that have helped. And I think whatever initiatives, like Vishu said, you're involving them, but also communicate it continuously to them that this is what the organization has been doing. And it's not only about the organization doing it, it's all about all of us being in the journey together. And after all, what are we working for? We are working for our families. And, they are the priority, and whatever we do is for them. So keeping that perspective in mind is always important. I think if I were to kind of put it in one way, the pre-pandemic world of corporates does not exist anymore. That paradigm has shifted permanently. This is a new world, and I think corporates are already adjusting to this new world and to this new paradigm. And I think it's all good news for the employees, colleagues rather, for everyone. That way.
Yeah, I think we're all in this together, it's safe to say. And we have been in this together for the last 3 years, and if not another 10, 20 years. Thank you so much, Amar. Thank you, Rishu, for your insights and thoughts. All right, I think Vrinda, I'm not seeing any questions on the chat, but what I'd love to do is, I normally when I have sessions like this, especially with leaders like yourselves, is if people do ask me questions, especially through Week in Care, I would love to connect with you again on LinkedIn outside of this and get those insights and give it back to them, because sometimes people just tend to feel that questions are not there right now, but maybe when they ponder over it over the week, there will be some. But thank you so much for sharing your insights, your leadership, your thoughts. I really appreciate you taking the time off. I have learned quite a bit because I've been looking at this from a Econ Care perspective, but not from a HR leader perspective. And I really appreciate you taking the time, especially now that we're towards the fag end of December and the holidays have started. I wish you a very Merry Christmas and a very Happy New Year. Enjoy time with the family and folks. Thank you so much, Amar and Rishu.
Thanks,
Absolute
Sandeep.
pleasure.
Thanks, Rishu.
Thank you, Sandeep.
Thanks.
Thank you.
Thank you.